Hi, everyone, and welcome to today's webinar, Clearing the Air, Transparency, Trust, and the Patient Financial Experience. I'm Mackenzie Bean, Managing Editor with Becker's Hospital Review. On behalf of Becker's, welcome and thank you for joining us today. Before we begin, I'd like to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link that you used to log into today's webinar to access that recording. And lastly, if at any time you have trouble with the audio or video, please try refreshing your browser, as that might help. You can also submit any technical questions into the Q&A box, as we are also here to help. At this time, it is my pleasure to introduce today's presenter. Shannon Burke is an industry veteran with more than 25 years of experience in the healthcare industry, particularly with technology startups, health insurance, pharmacy, and managed care organizations. She joined Synchrony Health and Wellness in December 2019 as Senior Vice President and General Manager of Health Systems. As the leader of the company's business development and strategy teams, she focuses on expanding offerings to the company's health system clients, practitioners, and healthcare technology partners. Prior to joining Synchrony Health and Wellness, Shannon served as Vice President of Technology, Health System Sales, and Customer Relations at SureScripts, where she led the sales organization and managed customers and relationships with more than 300 of the nation's top health systems and more than 100 major technology vendors and channel distributors. She's also held various leadership roles at companies such as MyHealthBank and PacifiCare Health Systems. Shannon, thank you for joining us today. We are so looking forward to your presentation. So with that, I'll turn the floor over to you to get us started.
Thank you, and good morning. Again, my name is Shannon Burke, and I'm very glad to be here. Thank you so much for taking time today to attend our meeting on Clearing the Air, Transparency, Trust, and the Patient Financial Experience. As noted by our moderator, I'm Senior Vice President of Health Systems at Synchrony, responsible for expanding CareCredit's patient financing offer at our partner health systems, which we have over 300 health systems partners today that accept CareCredit as a form of payment at their health system. And for those of you who are not familiar with CareCredit, CareCredit is a proven healthcare patient financing solution. We have been in healthcare for over 35 years. We have a lot of cardholders today. Many, I'm sure, may be using them at your locations. We are accepted at over 260,000 locations. You heard me mention the 300 health systems. And we offer those cardholders over $40 billion of improved patient experience and health system financial performance. So moving on, to our presentation, why transparency matters. Today's presentation is really all about covering the why and the benefits of financial transparency and the positive impact that that has for driving trust, satisfaction, and loyalty with your patients. I believe certainly that patient financial transparency is a cultural shift that has been happening for a long time. And that shift has largely been due to the rising cost of healthcare and the responsibility and the shift of that cost to the patient themselves, driving up the out-of-pocket. As you can see, deductibles have been rising 25% in the past 5 years. And the other really interesting data point that certainly has created this shift of patient to consumer is that 70% of consumers surveyed said that they have out-of-pocket costs even if they have insurance. And this has led certainly to what you would expect. Not a big surprise. It has certainly caused, I think, a primary cause of the shift to consumer. 70% of consumer surveys say they are confused about their medical bills. 83% of consumers say they prefer electronic payment methods to pay their medical bills, and they're having to do that by paper today. And 89% of consumer surveys say they want to know their payment responsibilities up front, which is certainly no surprise why over in the Gartner study recently, over 55% of health systems now offer a page with payment estimators and calculators for their patients. And I think this is indicative, certainly, of a shift from patient to consumer, which everybody talks about, but I think there's also this shift going on from consumer to customer, that patients are expecting, because they are paying significant dollars out of their pocket, they're expected to be treated like a customer, not just a consumer of care. So building trust starts with a conversation, and I would add to this information, and information about that financial experience and the obligation that ultimately the patient is going to have for the amount of care that they have to pay for and what they're going to owe. Not surprising, staff is under pressure. We've seen this certainly through the Great Resignation that happened through COVID, but staff has always been under pressure. And I always feel like saying, one of the things that we should be thinking about is how we make our revenue staff the heroes and why they should be considered the heroes. They have increased workloads, certainly no surprise to anybody here, and they're balancing some really challenging competing priorities. Certainly the first, and when I say staff, I would note that we're talking about both the clinical staff and the administrative front office and back office staff. When we think about who's running and who's providing care, it's the comprehensive group of the both clinical and administrative. And so if you think about what we do day to day in healthcare, the first thing they're having to balance is, providing high quality patient care. The second thing they have to balance is financial conversations, whether they're prepared or not, because again, I think patients are coming in with the expectation of understanding what their financial, or feeling as though for certainly that they will have a financial obligation. So being able to manage those financial conversations, and again, both clinical and administrative. And then of course the whole revenue cycle management and billing collection. And so these pressures are significant on our staff in health systems and within healthcare. And again, not surprising when the pressures of COVID hit, that like many industries, healthcare experienced a very significant resignation rate, and it did impact many of our health systems in terms of the ability to staff and how they were going to staff. So part of the remedy or solution to some of this pressure, not the only, but certainly a key factor, is equipping our teams, both clinician and administrative, with the right tools to help them be able to address some of those financial conversations and collections. So the second bucket that we just talked about, the overall financial conversation, and then of course the billing and payment, and making that as seamless as possible. We do believe that starting that conversation about financial responsibility early is vital. Providing estimates is important, and offering flexible payment options. And again, payment options are part of the solution, not the only part, but part of the solution that really patients are expecting. And it's at all points of care. Through multiple studies that we are looking at, patients more and more are using Dr. Web or Dr. Internet to go online and try to research their care before actually going for care. And oftentimes there is an expectation at that time that they want to understand their financial obligations. And so thinking about having and equipping your providers and staff with tools to have the conversations very early on, even before they reach you, when they're doing research, before they reach your location, and again, throughout the journey from pre-care to post-care and post-billing. And how to make the workflow easier. I think this is a big part of thinking about your revenue cycle collections process and your staff and the burden your staff has. And one of the things that we know to be true is that when we take staff out of their natural workflows to do anything, that creates more work and more stress. And so as you're thinking about how you want to make these conversations and how you want to inform your patients throughout their journey, one of the critical areas that you have to consider is, how do I make that a part of the tool set I already have in place? How do I make that an integrated part of what I do? So wherever you're collecting payment or wherever you might speak about payment, you would want to be able to embed that in the tool set or the digital tool set that you have already. And so any partner or anybody you would work with should be able to integrate their services directly into those solutions. Really important for both the patient and the provider staff in terms of just making the workflow easier. As a part of what we do every day, if you can enable your patients to get that information or start getting that information early through integration with your existing tool set, that's going to have a really positive impact when it comes to your staff, because it just reduces their workload. Certainly from the financial standpoint, CareCredit and other organizations are really there to enable you to take payments and get paid and be out of that cycle. And it's important to keep in mind that in doing so, doing it in a non-recourse financing way is really a great way to, again, reduce the risk, the financial risk of your organization, but also reduce the workload on your staff. And we're going to talk about when you do that, when you take that risk off of your organization and you pass that to a third party like CareCredit, you are able to really think about how you reduce that workflow downstream. So a lot of, the 2 points we're making here are around, how do I take work that is not necessary for the provider or the staff to perform and give it to somebody else, and then reduce my risk at the same time. And I think from a perspective, as you think about your staff, if you can enable your patients to make payments without engaging staff as part of the natural payment journey or the workflow journey that a patient has in your organization, that takes a huge amount of burden off. And then, of course, if you don't have to worry about collecting it, it also takes burden off your staff and time. So when a patient chooses to pay their bill in full with CareCredit, you really do empower patients to take control of their own healthcare costs. And they do that in a number of tools and ways we provide. So keep in mind, as you're allowing them to make the payments, they're then allowed to use these types of tools and services that CareCredit offers from the comfort of their own devices, which we know has always been something we do in other parts. We talk about a lot about healthcare being different, and healthcare is very different than many other verticals. But from a consumer or a patient standpoint, our expectations about our experience in payment or our experience in general, we compare to other verticals. Consumers and patients don't see healthcare as being different, at least as it comes to the services that they expect, and certainly the digital services they expect. And so you want to be sure you're providing them as they go through their financial and medical journey with the ability to do things the same way they do them in other parts of their lives, whether it be shopping or any other aspect of that. And they will compare that experience that they have on the digital side with their experience of the best, say an Amazon experience that they have, for other reasons in their lives. And so the expectation of being able to do things from my own device when I want to, at the speed I want to, is allowing them to be in control and to meet their expectations. And we certainly see the difference and how important these tools and online are. And certainly, whether you have a calculator or you don't, certainly having the ability to calculate out my payment after I know the payment. I know my payment, what that payment's going to be, and I'd like to know how I'm going to actually calculate out my payments for my portion. So online payment calculators that we offer allow patients to compare different financing options to help them choose one of the best that meets their needs. And this is kind of the unique experience. We say that every financial journey and payment journey for a patient is as different as their medical journey. So again, this allows them to customize for their needs and their purposes. And then when they're ready to pay, it makes for quick and easy payment options. And again, I get to sit down and I get to look at my bill of what I owe. I can then choose which plan is right for me. And then once I have that, I can make my online payment, which then relieves that burden from our partners and allows that patient to do what's right and flexible for them. So enhancing the overall payment experience, patient financial experience, and really looking at it through the lens of the revenue cycle and the payment collections. How do we, how do we think about that, and how do we enhance that for each patient? And I would say, certainly, again, we track a lot of patient studies, and one of the interesting things that we see is that patients now will vote for north of 50% with their feet. And if they don't like the experience, if they don't feel that they are getting experience that's tailored to their needs, they tend to be less loyal and less satisfied. And so in thinking about that, it's probably a really important thing to think about: how do we enhance that whole financial journey? How do we enhance that whole experience? And one of the ways we think has a very strong impact is to provide consistency and ease of access. And that starts, with the financial conversation early and continuing it throughout the patient's points of care and contact with staff, as well as the tools that are used, whether that be your website or whether that be payment portals or patient portals. Those are very clear ways providing consistency and access to the information and starting it early. And we do think about it now that the financial journey used to happen at the end of the clinical cycle. When I finished my care, I would submit my bill. The bill would be submitted, it would be adjudicated, and then I would begin my financial conversations. And we think that it starts absolutely when you start scheduling appointments. And it's very important, again, from a staffing standpoint and a staff satisfaction standpoint and workload standpoint, that you integrate those tools and services and options right within the same technology that your staff is using and that your patients access. It certainly can happen, and we talk about when scheduling pre-care. It certainly can happen during the check-in or check-out process at the point of care. It's certainly on patients or client forms. You can have information about financing and cost of care. And then on the provider website, as I said, social media. This transparency and consistency and ease of access at all areas of that journey really help to aid in a patient's overall satisfaction with what's happening. And we say, I mean, it's not surprising to say and obvious, but it is something in healthcare that we don't often think about it till after care is received. So this concept of pre-care, point of care, and post-care, and really giving that transparency and conversation and information is vital. And offer what matters to the patients. 66% of consumers surveys say they would consider switching providers for better healthcare payment experience. What I said earlier, we will vote with our feet now more so than any other time in healthcare. And while we're very committed to our physicians and our places of care, we will vote with our feet if that experience, that financial experience, nobody wants to be surprised. Nobody wants to be ill-informed. And so really a good revenue cycle, collections process, financing process starts at the, again, point of care and flows throughout. And wherever we can, give the patients what they're asking for, give the customer what they're asking for, which is payment experience. So transparency and ease of payment, as I said, drives satisfaction and loyalty. 75% say that it impacts their trustworthiness. 72% want to pay very quickly and want to make it very easy. Of those who were surveyed, this is what we came, and they were certainly extremely satisfied if their provider offered quick and easy payments, and certainly felt as though that they had the trust, that they could trust their overall experience of physicians. So let's talk about some of the key takeaways for today. Certainly facilitating trust and transparency, very vital to what we think about when we think about the financial experience. And having those conversations, and I would add information available for both patients and staff, is going to be a really important factor in driving that trust and satisfaction from both your providers and administrators and your patients. Help staff streamline. Arm them with the knowledge, arm them with the tools, and arm them to be able to have those conversations, to be comfortable with those conversations. And part of that is going to be taking training and support, ongoing support. Start those financial conversations early. Don't be afraid to start them. Everybody in the organization should be trained and knowledgeable with that information to have that conversation on some level. The conversations will be different depending on who and where in the journey you are, but really start the conversations early and provide estimates. One of the key critical areas is, again, as you're thinking about how you want to inform and how you want to enable and to make a patient feel as if they're in control and feel as if they understand what's happening with what they are going to owe. Estimates are more and more, we're seeing that certainly, as I mentioned, 55% of health systems have estimators. So we're definitely beginning to see that. I think culturally, the transparency of that has really been put on steroids over the last several months and years, and I don't see that changing. And then, of course, we believe as a part of your overall revenue cycle process and financial process, offering flexible financing options as part of your solution to patients is not only good for, I think, and expected, but at the end of the day, it's, I think, required for many, all generations, but especially the under 50, want the offer of it. Most want it and expect it and certainly think of it as part of their overall healthcare wallet and healthcare payment options. So helping improve the patient experience, the right third-party financing partner can help here. We talked about accessible financing options. I think part of the story here is where do you offer patient financing? And I think if you think about ways to pay or the ways that we enable patients to pay, the first is obviously cash, credit card, check. I'm willing to pay, I'm willing to have and give you my Visa, Amex, or I'm willing to pay cash or credit card. The second thing is non-recourse patient financing. That is right in there and should be part of your whole thinking of for patients who want to finance who have a large bill or who just simply can't afford to pay that bill all at one time or would prefer to pay the bill over time. Offering non-recourse financing is absolutely vital, and that fits between cash, check, credit card, and then ultimately the last part, which is the financial assistance programs that all, if not many, if not all of you offer that allow for patients who are unable to pay some options. So it's thinking about it as a full plate or a full road from here, pay all at once, finance, I'll assist if you need help. I certainly think easily see if pre-qualification, and that's really the financing piece that I said. If you can, there's certainly ways to offer financing early on, and we certainly can pre-qualify that as needed and feel like we're informed and in control of their health care. So really this idea of do I have the option to finance? Can I pre-qualify for that financing? And I feel now informed of how I want to pay. All of that is, again, putting the power and giving the knowledge and information to the patient that really improves the overall experience. And what does that improve? Of my loyalty, my trust, and my satisfaction as a patient. So with that, I would love to answer any questions that the audience has.
Wonderful. Thank you so much, Shannon. This is such a great presentation. We've already had a lot of great questions rolling in, but audience members, if you have any other questions that you'd like to ask Shannon, please feel free to submit those now by typing them into the Q&A box that you see on your dashboard. The first question is an interesting one from an audience member who is asking, have you noticed a dollar amount threshold where patients are more likely to pay? For example, maybe patients are more likely to pay if the balance is less than $500, et cetera.
Yeah, yes. The answer to that is yes. Once you get to the point of, I would say average bills that we see that are going to be, patients are going to look to finance are somewhere in the north of the $800 mark. Once you hit an out-of-pocket of about $800, patients, regardless of their socioeconomic, are interested in financing options. And I think that's largely or certainly impacted by the fact that much of healthcare we experience is not something you necessarily budgeted for. So any bill over about $800, they're going to be very interested in financing. We accept financing over $200, but again, the average that is financed is about $800. And what we see, and this is a really important thing, is that about 125, and it varies, I would say between 100 and 150, but about 125 on average is about the payment most patients are willing and able to make to a financing. So the type of offers that you make are important. In other words, allowing a patient to choose 6, 12, 18, 24-month financing is important because really you're subliminally allowing them to make the payment amount that is right for them based on what they owe, and that payment amount will be somewhere between 100 and 150 that will be acceptable to the patient on average. These are, again, all averages, but we have obviously quite a bit of data to help us look at those averages.
Got it. That's helpful to know. Thanks, Shannon. We have another audience member here who says some patients may be hesitant to use a credit card to pay for major healthcare costs just because of the risk of owing interest. How would you respond to this concern, in a transparent way?
Well, the first thing I would say is I don't think patients are hesitant to use a credit card. They do use credit cards. They use a lot of credit cards. As I said, there's the bulk of payments are going to be made by a credit card. And so whether that's Visa, MasterCard, et cetera, when they get their bill, the majority pay by a credit card. And that being said, I think where patient financing comes to play is that if I don't want to use a traditional credit card that has significant interest rates, and I do want to think about financing, back to kind of the point I made earlier, what is, yes, I'm going to use this healthcare credit card, but I do have the benefit of choosing my financing to that. And if I pay the balance by the promotional period, I will not owe interest. Obviously, if I don't, I do owe the interest. But you have the opportunity to have the deferred interest programs, and that is a real benefit to somebody who has a large bill and wants to pay over time because they either want to or need to, have to pay over time, and that allows them the ability to defer or eliminate that interest if they're able to pay it off during that promotional period.
That's a great point. Yeah, it seems like, a lot of interest in credit cards right now. So appreciate you weighing in there. It
does kind of come back to that concept that I started talking about. And, where does patient financing fit? And I talk a lot about this is first of all, I think the majority of our health systems that we talk to like the fact that we are non-recourse. So I think that that's important to note, meaning that we take the risk, we don't give it back, regardless of whether we collect or not. And over 80% of our cardholders pay off their bills before financing incurs. So I think that there is a real fit for patient financing between offering your traditional payment forms and then when financial assistance programs kick in. And I often say that one thing that is important is care credit is kind of assurance after insurance. If you don't have it, or if you have it and you end up with a large bill, you have that assurance that you can put that on your care credit card. And then it offers really, again, something that I like to say, if we're there for a part of time. It's not the complete. We don't think everything should be paid with a care credit card, but it is before financial assistance. So for those patients who can't or don't want to pay traditionally, this is an option. And what we've seen over and over in the surveys, more and more patients really, I think it was 66%, expect to have those options given to them as a means or as a way, as part of payment. Whether they choose to do so is a different matter, but they expect to see them. And not surprising. Again, I mentioned earlier, as we go through life and we've experienced so many different types of purchasing consumer experiences, we often see these options to pay over time on various websites that we visit for other parts of our life. And so they've become accustomed to having that, buy now, pay later kind of mentality or ability to put it in installment loans. And so this reflects that in healthcare. And it's relatively new in healthcare. It's not new to the consumer in their life, but it's new in healthcare. And again, we have been people's question might be, you've been in healthcare for 35 years. We have, And where we started was really on the elective side, very much in the dental, cosmetic side of care, or areas where there was high out-of-pocket, naturally high out-of-pocket, audio, visual, etc., either where there's no insurance or very, very high out-of-pocket. And within the last 5 to 8 years, we've really been expanding that to all services, elective or non-elective, inpatient or outpatient. And it's really for any reason for myself, my family, or my pets that I find myself with a large out-of-pocket expense for the health care of my family or myself, I can use this care credit card. So hence why we have so many card holders existing. But in health systems and traditional non-elective care, we really are just beginning that journey. And so, again, I think patients are really expecting to see this as an option, expecting to see financing options because of the training and the rest of their lives. And this gives us, our partners, a great way to meet that expectation.
Absolutely. I mean, 66% of patients wanting those types of services is a significant number, and I wouldn't be surprised if it continues to grow. So appreciate you expanding your thoughts on that one. The next question is on the price transparency piece. The question is, with the No Surprises Act going into effect at the beginning of this year, is transparency still a concern for patients?
Well, yes. I think it's just one attribute. The federal government and state, I should say, federal and state regulations and requirements overall in healthcare have really shaped and formed, whether it's an interoperability or EHR adoption. We could go on and on about when the federal government starts to impose rules and regulations on our ecosystem. It changes our culture. And I mentioned earlier that we really have been on this shift because of higher out-of-pockets and all the things we discussed. And this is really now the true push now that the federal government is encouraging it. But it's going to be our expectations where we are in that transparency journey is not nearly as far as it will be expected by patients and consumers. So while the No Surprises Act certainly drives certain requirements of posting charges, et cetera, there's still going to be much work to be done because it's very challenging to tell me, Shannon Burke, what I uniquely owe. But you can tell me, Shannon Burke, what we think, right, through estimations and whatnot. I think the No Surprise Act, actually is just adding fuel to the fire. I think transparency and the demands for transparency by patient customers is going to increase. And I think the providers and health systems who understand that, acknowledge it, and continue to drive, again, for the whole journey, starting at when we think people are researching their care all the way through post-care and the post-billing, that we just embed that transparency, that knowledge, that information, both in the digital tools, again, that I access as a patient, and the tools that my staff utilize to process and manage payment. So again, the winners in this are going to continue to look for ways to bring additional transparency on the financial experience to their patients over time.
Absolutely. Thank you again, Shannon. We have a question here in relation to the deferred interest piece that you previously spoke about. Is there a minimum or sliding balance for deferred interest? How does that work?
It does vary. Typically it's 200 is our minimum, and it varies a little bit, but that we set those up in order, the 200, because we believe that's about the time they will look. Ultimately, what they finance, as I say, is around that 800 mark, and it depends by market, by the way. Some of our markets are quite a bit higher than if you were to look at an individual market, say audio, they finance quite a bit higher than that. So when I say average, it's an average if you're looking at it across the board. but 200 is minimum. And I think the key here is offering them a broad offer of what they can take advantage of, payment terms. Allowing that individual, again, I think I mentioned it in the presentation, but one of the things we absolutely know is our financial journey individual is just as individual as my medical journey. And my needs need to be customized, and I want to be looked at as a individual. And so I want to have, as a patient and customer of a provider or health system, I want to have those options. So offering, I think the health systems and providers who offer the broadest promotional mix to allow me to make the choice of what is right for me at this time that I'm paying this bill is really vital. And again, we know from a statistical average, we're talking in the ballpark of somewhere between about $125 is typically what I want to be paying for my out-of-pocket balance that I owe.
Got it. That's very helpful to know. The next question is about gaining staff buy-in. So this audience member is saying that talking with patients about financing and guiding them through the application process seems like it can be a task that healthcare staff just don't have time for. What advice can you offer for getting busy staff members on board with the financing program?
I love this question. Thank you for whoever asked it. It's asked of us all the time. You know, the first thing I would say is integration. So in other words, again, if you track how patients are accessing care and researching care, the more we can integrate that information into your existing technology and solutions today, just takes the burden completely away from staff, right? I mean, if I can learn about that option of payment early on, even when I'm researching it on your website, or I can learn about it in your payment portal, or whatever that might be, depending on what your balance is between patient-initiated pay and provider-initiated pay, meaning that who actually starts the process of payment. Making sure it's integrated seamlessly, like there is no difference. The patient cannot discern the difference. They don't have to lead to another portal. It's branded. It looks like what you have there, that allows that patient to do the work early on or get that information early on. That's the first thing. The second thing is, just from a functional standpoint, is integrating into your whatever payment system you have, making sure that it's easy for staff. In terms of the knowledge and information, you need to partner with a financial services partner who understands healthcare and who understands the question that you just asked. Is so unique because, again, since the dawn of time, certainly the actual payment process, collections process happened in the back office and was completely opaque to the patient. I shouldn't say from the dawn of time. Since we started insurance, it's just been for the last 50 years very opaque to the patient. And now the patient, having needs of, seeing more because they owe money, and are in money oftentimes in very large amounts, needs to have the transparency. And so in the past, we really haven't had to arm our staff with information. And now we have all kinds of tools, all kinds of in-person tools. We come on site and do trainings. We do refresher courses. We have printed tools. We have some of the best support methods in all types of channels to help your staff get to that point. And we've worked with many, many health systems to address this very issue. And what I will ultimately say about the training and knowledge that's outside of the integration piece that I said, that would be just a first step for me. If you can't integrate it, I probably would think twice about that partner. But integration is without question, both for the staff and the patient. But then you need a customized approach that meets your culture on the training and knowledge transfer and support and ongoing support, because it's not one and done. You have staff turnover, you have staff that need more hands-on training or more training than others. Some are more comfortable, some are not. You need a very customized approach of training that gives you a partner that has a broad, deep tool set. And so really with our health system, we sit down and customize that based on what they have. We also use your existing learning management systems in place. So we integrate with that. And again, each program for each of our health systems utilizes that tool set, but often utilizes it in a way that works for them. And I can assure you, we've been through this process, and we love that question because we are incredibly well prepared and equipped to work and do that with you that works for your culture and your organization. And it is probably the hardest thing. It is one of the hardest challenges, I think, that health systems and providers face today, and that's why I'm so passionate about it, that just really find a provider who can get you there, because it's certainly out there and you can get there, and it will be good for your staff and it will be good for your patients.
Absolutely. A great question and a great answer. So thank you both there. The next question is from an audience member who writes, providing estimates based on out-of-network fees is a challenge. What are some ways to provide estimated costs to patients with out-of-network coverage?
Yeah, out-of-network coverage, well, I'll just answer it from an estimate. It is challenging, and I wish I had a magic answer or a better answer than what I'm going to give, but I think you need to partner either with your EHR estimating tools or a third-party estimator. But there are partners out there that can help you provide patients with an estimate of their care pre-care. And I think it's really finding the right partner to do that. But what I would say is that as we move forward, I think that is going to be an absolute expectation and must for large health systems and providers to have available to their patients who want and need that. And again, unfortunately, personalizing it again to you or me or your neighbor is a little bit challenging, because we all have different third-party insurance situations, and we're all at a different part of the year in our insurance cycle. So it can be a little bit more challenging, but you can get, the point of estimation is to start the conversation and get you started in the ballpark. It's not to say, here's what your bill is going to be at the end. So you have to use it properly. But again, I want to also assure there are many good estimating tools out there. And again, many of our partners use their EHR's estimating tools because it just, again, fits that concept of integrated, consistent experience and support. And the more you can create a consistent, integrated support for your patients and for your staff, the easier and frictionless experience you're going to provide. And the less friction you provide, the satisfaction both from providers and from patients, your customers, is going to increase. So I highly recommend getting a good partner and making it integrated and as frictionless as possible early in the process.
Wonderful. Well, that is all the time that we have left for today, but for all our audience members, please don't hesitate to reach out with any other questions after today's session. Shannon, I want to thank you again for your time and all of your thoughtful remarks today. And I'd also like to thank CareCredit for sponsoring today's webinar. Thank you all so much for tuning in today, and we hope to see you at future Becker webinars.
Thank you so much. I appreciate it. Have a great day.